Parliamentary Secretary, Mr. Amrin Amin.
We are encouraging greater personal responsibility for healthy living and community partnerships to make healthy living more accessible and sustainable for Singaporeans. I will touch on three key areas: the war on diabetes, health promotion efforts for all, particularly seniors and ethnic minorities, and tobacco control. Mr. Chen Xiaomao and Mr. Baey Yam Keng asked for updates on the war on diabetes. Ms. Cheryl Chan spoke about helping Singaporeans lead a healthy lifestyle. We will continue to support all Singaporeans, regardless of economic and socioeconomic backgrounds, to eat healthily, be screened and exercise as part of our war on diabetes. HPB's Healthier Dining program offers more affordable, delicious and nutritious food options. In addition to food courts and restaurant chains, we have extended the Healthier Dining program to coffee shops and hawker centres in December 2016. More than 3,000 stalls in coffee shops and hawker centres, as well as over 2,000 F&B places are under this program. We now have healthier mee soto, chapati, and carrot cake, just to name a few. So yes, you can have your cake. Just make sure it's a healthier cake and eat it too. So eating healthy and well is possible. Mr. Chen Xiaomao asked for an update on plans to develop low-sugared food and drinks locally. In July 2017, HPB launched the Healthier Ingredients Development Scheme, or HIDS, to build our food sector's capabilities to innovate and produce new, healthier food products like healthier oils, rice, and noodles. As of December 2017, we now have 14 partners offering 37 healthier products supplied to over 2,000 food and beverage stalls. Let me share one success story. With the support of HIDS, Mr. Desmond Goh from People Bee Hoon invested in R&D, marketing and trade promotion of new whole grain healthier bee hoon. Sales of chili brand whole grain bee hoon doubled over the past few months. This means that more families are buying, cooking, and eating healthier bee hoon. We'll be further extending the HIDS grant to include sugar-sweetened beverages, desserts, and sauces. Such food products contribute to about 90% of total sugar intake in our diet. I'm happy to announce that HPB will be providing an additional 15 million on top of the current 20 million grant to support innovation in healthier food categories. This is a potential game changer, benefiting Singaporean families and could contribute to reducing sugar in Singaporeans' diet by 25% by 2020. We are working with MTI through EDB and Spring to align our industry efforts, including through the Industry Transformation Map for food processing. Together, we will spur businesses to innovate and market new, healthier food products. Ms. Tin Pei Ling asked about efforts to promote lower consumption of sugar-sweetened beverages, or SSBS, and to help young children develop healthier dietary habits. Current efforts, such as the Healthier Choice symbol and the Healthy Meals in Preschools program, have shown encouraging results. The market share of lower sugar beverages marked with the HCS symbol has grown from 30% in 2012 to 43% in 2017. Under the Nurture SG initiative, we have partnered with Early Childhood Development Agency to ensure all preschools only serve drinks with the HCS symbol from 1st January 2018. We are studying sugar reduction measures from other countries such as the UK and France. UK and France have implemented color-coded front-of-pack labels for food and drinks. The UK uses traffic light colors to tell consumers whether a food item has high, medium, or low amount of nutrients such as sugar and saturated fat. France has Nutri-Score, which scores the nutrient content of food and drinks. Some countries have implemented a tax on SSBS to encourage manufacturers to reformulate their drinks and reduce the sugar content. In 2016, the UK announced a two-tier levy on pre-packaged beverages. The purpose is not to raise revenue, but to encourage product reformulation. Although the levy only takes effect in April 2018, the UK authorities have shared with us that more than 40% of affected products have been reformulated. MOH will carefully review this and other measures to encourage product reformulation and conduct a public consultation before deciding our next steps. Moving on to screening. If discovered early, interventions such as diet and exercise can prevent pre-diabetes from worsening. Younger Singaporeans are advised to go for diabetes screening if they are at higher risk of having diabetes. Risk factors include a family history of type 2 diabetes, overweight, or high blood pressure. We are helping Singaporeans between 18 to 39 to assess their risk for diabetes through the Diabetes Risk Assessment, or DRA, on HPB's Health Hub app. To date, the DRA tool has been used about 116,000 times by younger Singaporeans. Those identified as high risk for diabetes should go for medical screening. For those above 40, they should go for regular diabetes screening once every 3 years, and they can benefit from subsidized screening under Screen for Life initiative. Moving on to stepping up to the challenge of an active lifestyle. On active lifestyle, we have made strides in the first 2 seasons of the National Steps Challenge. And HPB has rolled out the 3rd season in October last year. More than 650,000 people have signed up and clocked more than 260 billion steps. This is equivalent to 200 million kilometers, or more than 5,000 times round the equator. We are working with Sports SG to organize more fun, social, physical activities for all ages so that Singaporeans can have access to them at various community and workplace settings. On the second area of health promotion efforts for seniors and minorities. On seniors, I agree with Ms. Cheryl Chan that we need sustainable preventive health efforts to address the needs of an aging population. And we have stepped up efforts to improve healthier living in this aspect. Through the Community Network for Seniors, HPB, with support from Silver Generation Ambassadors, has implemented several active aging programs. Let me share some highlights. Over 24,000 seniors have attended Seniors Health Curriculum, a series of workshops to improve seniors' physical, mental, and functional health. Community health posts located in the neighborhoods offer health screenings, regular health coaching, and lifestyle follow-up for seniors to help manage chronic conditions better. As of December 2017, over 3,400 senior Singaporeans have benefited from these health coaching sessions. And thirdly, we have started senior-centric exercise programs such as Zumba, Zumba Gold, and Fit Plus, and mass workout sessions under the Community Physical Activity Programs, or CPAP. Over 159,000 older residents have participated. Ms. Joan Pereira suggested that the ministry review information on diabetes management and diet for elderly patients and their caregivers. The Patient Empowerment for Self-Care Framework aims to help Singaporeans with diabetes initiate and sustain lifestyle changes. Under the framework, we will develop a national curriculum to equip persons with diabetes with knowledge and life skills to manage their condition. We will take on the good suggestions by Ms. Pereira, and we will review on information on diabetes management and diet for elderly patients and their caregivers. On health promotion among ethnic minorities, we are seeing greater awareness among Malay and Indian communities on health matters, but there is more to do. Sir, allow me to share in Malay some of the initiatives for the Malay community. Pada Ogos tahun lalu, saya melawat pelawak terkenal alias Kade, alias terpaksa menjalani pembedahan untuk memotong bahagian bawah kirinya kerana penyakit kencing manis. Beliau sebenarnya menghidap kencing manis pada usia 40-an tahun, tetapi tidak mendapatkan rawatan. Akibatnya, beliau mengalami komplikasi. Nasi sudah menjadi bubur. Sebelah kakinya ibarat sudah berpatah arang, tidak boleh disambung lagi. Namun selepas pembedahan tersebut, alias berazam mahu berubah. Beliau juga mahu kita semua mengambil iktibar daripada pengalamannya, bahawa sesungguhnya kita harus beringat sebelum terkena. Dan jika sudah terkena, janganlah meremehkan pentingnya pengambilan obat dan menjaga makan minum. Serta jangan endah rawatan susulan dengan doktor untuk mengawal penyakit kencing manis. Penjagaan kesihatan adalah komitmen seumur hidup. Kami sedang bekerjasama dengan ramai rakan kongsi dalam masyarakat untuk membantu masyarakat Melayu kekal sihat pada setiap peringkat kehidupan. Saya akan berkongsi 3 bentuk kerjasama. Langkah pertama, ke arah pemakanan sihat. Kami mengorak langkah bekerjasama dengan pihak-pihak penyedia makanan untuk secara perlahan-lahan mengubah cara makanan kita di peringkat masyarakat. Misalnya, kami sedang bekerjasama dengan Persekutuan Kulineri Halal Singapura dan caterer majlis-majlis perkahwinan seperti Eternally Yours dan Jamil Catering, supaya mereka dapat menyediakan pilihan makanan halal yang lebih sihat. Jadi menerusi langkah ini, diharapkan masyarakat akan dapat secara bertahap-tahap mesra kepada makanan sihat tetapi masih sedap rasanya. Langkah kedua, ke arah masjid-masjid penggerak kesihatan. Menjaga kesihatan dituntut oleh agama. Kami sedang bekerjasama dengan MUIS dan hasilnya tercetuslah program Jaga Kesihatan, Jaga Ummah, di mana HPB bekerjasama dengan masjid-masjid menganjurkan kegiatan gaya hidup sihat. Dan hasilnya juga, 15 buah masjid kini menyertai inisiatif kesihatan ini. Kami berharap inisiatif ini akan berkembang dan menjangkau 20 masjid menjelang akhir tahun ini. Jadi apa yang dilakukan di masjid-masjid tersebut? Ia menyediakan perkhidmatan bagi membantu para pesakit kencing manis mengawal keadaan mereka, memberi pemeriksaan kesihatan dan juga aktiviti fizikal yang dilaksanakan. Kami gembira melihat lebih banyak masjid menyertai inisiatif seperti ini. Contohnya, Masjid Al-Mawadah menghantar kaki tangan kantin mereka latihan memasak anjuran HPB agar hidangan yang lebih sihat boleh disajikan di masjid. Harapan kami, makanan sihat dan tetap sedap menjadi santapan di semua masjid sama ada sempena majlis keramaian, berbuka puasa, sambutan hari raya dan sebagainya. Masjid harus menjadi penggerak kesihatan ummah. Langkah ketiga, ke arah masyarakat cintakan senaman. Kami akan menambahkan lebih banyak ruang dan peluang untuk masyarakat Melayu kita melakukan pelbagai aktiviti-aktiviti senaman atau fizikal. Saya misalnya sudah melancarkan inisiatif Get Fit for Umrah, iaitu mengajak para jemaah supaya membina kesihatan dahulu sebelum mengerjakan umrah. Ini dilakukan dengan sokongan syarikat TM Fauzi Travel and Tours tahun lepas. Kami akan mengembangkan lagi program ini supaya lebih ramai jemaah umrah dan haji dapat meraih manfaatnya. HPB akan bekerjasama dengan Persatuan Agensi Pelancongan Muslim Singapura, AMTAS, untuk menyertakan lebih banyak agensi-agensi Muslim supaya menggerakkan juga inisiatif ini. Supaya selain terkenal sebagai jemaah yang penuh disiplin di Mekah dan Madinah, jemaah Singapura juga dikenali sebagai jemaah yang sihat-sihat dan cergas belaka. Saya gembira dengan sokongan masyarakat yang kuat. Mereka yang turut serta di 4 sesi perbincangan kesihatan awak okey di Geylang, Jurong, Tampines dan Woodlands yang turut bersenam bersama, contohnya di sesi Zumba di Tampines Hub, dan yang turut menyingsing lengan para doktor, jururawat dan rakan dari Persatuan Profesional Penjagaan Kesihatan Islam, MHPA. Ayuh kita sama-sama berusaha membina masyarakat yang cergas, sihat dan alfiat. Turning to the Indian community. Indian community organizations like the Hindu Endowment Board and SINDA are actively promoting healthy living to the Indian community. We want to complement and build on these efforts in 3 ways. 1. We will intensify health outreach to the Indian community through places of worship, Indian F&B outlets, and Indian media to promote healthy eating, regular physical activity, and regular screening and follow-up. 2. We are partnering Sikh and Indian temples to bring health programs such as screening, exercise, and healthy cooking programs. And third, we will leverage social networks to train health ambassadors and equip them with skills to actively reach out to and promote healthier living to their family and friends. The final key focus area of my speech is tobacco control. Dr. Chia Shi Lu asked what other measures we are considering to reduce tobacco use in our population. This year, we will be launching a new public education campaign to encourage Singaporeans to live a tobacco-free lifestyle. We will re-emphasize the harms of environmental tobacco smoke and the harms of tobacco. We will have a ground-up campaign involving youths in schools and institutes of higher learning. HPB will also work with partners such as Singapore Cancer Society and the Football Association of Singapore and other partners to reach out to all, and in particular, youths on social media, in schools, and in other places. We will continue to enhance our smoking cessation services to support smokers on their tobacco-free journey. HPB will engage more workplaces, such as taxi and bus transportation sectors, to help employees to quit smoking. We hope to see more companies create a health-promoting working environment for their staff. There continues to be a debate on e-cigarettes. We debated this last November. Our position is clear. Any product that contains nicotine can cause addiction and pose risks to health, including e-cigarettes. We want a nicotine-free and tobacco-free future. We will allow e-cigarettes only if they are scientifically proven to be effective nicotine replacement therapy products for smoking cessation. MOH is also considering introducing standardized packaging. Singapore recently announced a public consultation to gather detailed views on a proposal for the introduction of standardized packaging, together with enlarged graphic public health warnings. The public consultation will end on 16 March 2018, and we invite interested parties to submit their views. A final decision on whether to introduce the standardized packaging proposal will be made only after the public consultation. We will ensure that any measures, if introduced, are consistent with Singapore's domestic laws and international obligations. MOH will continue to invest and promote good health. We will work closely with individuals, families, industry, and community partners, but personal responsibility for healthy living remains key. Each of us has to do our part. Our goal is to realize a sustainable healthcare future where all Singaporeans enjoy better health, better care, better life. We ask for your support. Thank you.